News Radio 700 WLW.
Of course, the big story that broke overnight, and a lot of people woke up to the news today that the only child of Elvis Presley, Lisa Marie Presley, passed away yesterday. She went into full cardiac arrest at her home in Calabasas, which is on the outskirts of Los Angeles. And about 6 minutes later, paramedics arrived. They found her in the condition she was in, took her to the hospital. Her mom was with her inside the hospital. That would have been Elvis's ex-wife, Priscilla Presley. And shortly thereafter, Elvis's only heir, Lisa Marie Presley, died at the age of 54, which seems very young, I would think, to just anybody anymore. There are a lot of speculations as to why so many people in that family are dying early. I mean, Elvis Presley was 42 when he died. His mother was 46. He had three uncles in their 40s. And then, of course, his daughter dying yesterday at 54. So when they talk about genetics, is this what they're talking about? And why would somebody so young, 54 seems young anyway, but normally when you hear about heart attacks, mid-50s, you immediately think, gender-wise at least, male, not female. Anyway, standing by to weigh in on all of this, we've had Dr. Fahmi Farah on the show many times. She is a cardiologist and medical expert, and she has been willing to give us some of her time here today on 700 WLW. And Dr. Farah, how are you on this glorious Friday the 13th?
Hey, I'm doing well. Yes, you just reminded me it is Friday the 13th.
Yeah, I am. I'm looking for black cats, and I'm avoiding those at all cost. Look, Lisa Marie Presley was 54 years old. That's very young, I think, by anybody's standards. But she did have a history of heart disease inside of her family. Now, I know you're not her doctor, you're not treating her, but you certainly know about cases like this. Would it surprise you if this was nothing more than genetics in her case, or do you think it might be something different?
It could certainly be genetics, especially with her family history, her father dying at an early age, and then, his family member dying at an early age. So the genetics can definitely play a factor. We know that much of heart disease can be related to genetics, such as heart attack.
But I think when most people think 54 years old, heart attack, they think of male, not female. How common are heart attacks among women as opposed to men in their mid-50s?
It's actually quite common. And in fact, it's a misconception that heart attacks happen more commonly in men than females, because we lose a lot of females to heart attack every year. So yes, females can definitely have heart attack at early ages. I have many patients who have had heart attack in their 30s who are females. So it can definitely happen for females and males equally.
This was a family that Elvis's grandparents were cousins. And then, of course, there was Elvis, and then, of course, there was his daughter, Lisa Marie. So when you get that kind of a dynamic inside of a family, would it be more likely that from a gene standpoint, a genetic standpoint, that any malady may be passed on more readily than if it was just a family that came from opposite sides of the spectrum?
I believe, yes. When family members tend to marry within the family, there is a higher chance of the gene to be passed on, because there's less genetic pool that you're pulling from. So common gene, then that gene is more likely to be passed on if there's marriage within the family.
They said the paramedics got to her within 6 minutes of the phone call being made. Now, I don't have any idea. The news accounts have no idea how long that she had been in full cardiac arrest. But it seems to me if you go to, and when they arrived, they found signs of life. I mean, is it normal after 6 minutes, someone that's in full cardiac arrest, 6 minutes later they could find a sign of life? I don't know. That's why I'm asking.
Yeah, it's still possible. Like when they came in, if they started CPR and they saw that she had a return of pulse, then that would mean that there's still life present. And that's part of the reason why they were able to still bring her to the hospital while she was still alive. Now, You're right. The paramedics arrived 6 minutes after. At what stage the CPR was started? Did she receive any CPR prior to their arrival? That was crucial. Like, that could have made a difference. In terms of out-of-hospital cardiac arrest, in general, they carry a very poor prognosis. Between 70 to 90% out-of-hospital cardiac arrest patients don't even make it to the hospital alive. Now, that statistic can be changed if CPR is started at a very early stage of the cardiac arrest. The fact that 6 minutes were lost, and we don't know exactly how long was actually lost, but we know that at least 6 minutes was lost.
Yeah. We're chatting about Lisa Marie Presley passing away overnight from a heart attack, 54 years old. Dr. Fahmi Farah is our guest. She's a cardiologist. We've had the good doctor on with us many, many times before. I guess she had done an interview at the Golden Globes or whatever award it was earlier this week, and the interviewer said she seemed a little off. I don't know what that means either, a little off. I think most of us are a little off consistently in our lives, and not necessarily because of heart failure or heart attack. What would a symptom or would a problem manifest itself in some way, shape, or form like being, quote unquote, a little off? I'm just wondering if there was a way maybe that somebody could have done an intervention here, or if this was just fate and it was going to happen anyway.
Yeah, sometimes people who have blockages in their heart prior to heart attack, they can have warning signs like chest pain or shortness of breath or just fatigue. Especially in females, a lot of times females don't get the classic chest pain symptoms. They can have atypical signs and symptoms such as just fatigue or just being sleepy, just not having the stamina. So all of those could be early signs that something's going on internally.
And we don't even know what was certainly a mitigating factor in all of this, which would be, I would think, for anybody, would be stress. I mean, she was somewhat of a celebrity. She lived a very public life. She married a lot of public individuals. Some of the people she married had substance abuse problems. Another mitigating factor, and again, we're speculating here, but it's certainly a mitigating factor in a lot of heart attacks, is stress. She might have been under undue stress just because of the lifestyle she led and the person she was. And, all that is fame is not all that it's cracked up to be. And that could have had something to do with it as well.
Oh, absolutely. Lifestyle plays a huge factor when it comes to heart disease and heart attack, along with the as you mentioned, the stressful lifestyle. Stress definitely is a risk factor for heart disease. What kind of lifestyle, in terms of what kind of food she was eating, how much exercise she was getting, how much sleep she was getting, and if there was any substance abuse at all, that could play a role as well. Was she a smoker? Was she a heavy drinker? All of those would manifest into into causing a heart attack.
Yeah, I know she, at one point, she appeared before a congressional hearing in opposition to the drugs that were used to treat ADHD, and she referred to them in this hearing as a cocaine-like stimulant. Now, certainly not, we're not saying that she was doing coke, but she was on drugs, I guess, to treat ADHD. So who knows? I mean, we're all a product of where we come from, and who knows what was taken earlier in life would not have a role in the way we leave this earth. It could have been anything like that. But I think you said something that was very profound and very important. When you hear heart attack and you hear 50, it's not just men, it's also women. And they just manifest, those symptoms just manifest themselves in a different way from men. That was a really good point, Doctor. We appreciate your time here this afternoon. You stay well, because we need to hear your voice, okay? We'll visit down the road.
Thank you so much, Ken. It was great to be here again.
Yes, thank you.